Authentic You is a group practice located in Flemington, New Jersey, serving primarily individuals and their families struggling with eating disorders, anxiety, body dysmorphia, and depression. Authentic You is unique in providing both therapy and nutrition services. Today, we have the two at the helm, Kathleen Wright, licensed clinical social worker, and Michelle Wright, registered dietitian, here to tell us more. Michelle and Kathleen, thanks for chatting today.
Well, thank you for having us.
Thank you so much for having us.
Oh, absolutely my pleasure. And tell us a little bit more just about the basics. What do you do on the day-to-day there in your practice?
So I think, every day looks a little different. But the majority of it is we have clients coming in, and they see me for therapy. We also have a few other therapists in the office who specialize in, other areas, but I see them and then pass them off to Michelle or vice versa. So for me, it's primarily, seeing clients individually for therapy sessions. And then Michelle does her nutrition piece.
Yeah, I'll see them for nutrition depending on what they're here for. I work with all, aspects of patients' nutritional needs. So, majority, we do see a lot of patients struggling with eating disorders, but I will also see people for regular healthy eating, weight management, ARFID, which is kind of, a little more severe than picky eating, kids, adults, they want to come in for diabetes, weight loss, whatever it may be. I do a whole variety of different things basically to help people with their nutrition needs.
Wow. And now I love the Mr. Rogers quote, look for the helpers. And you are obviously helpers here, big time. But how do people find out about you, the resource that you give, and the specialization that you have?
So I think it's interesting because, again, I think a lot of people know about Michelle and I independently. So basically for years, I had been in Clinton in a private practice, and Michelle was working with the Hunterdon Health System, and we had so many similar clients, and so we got to know each other really well, talk to each other all the time. We have a very, very similar mindset, approach. So just about a year ago, maybe not even a year, but I approached her and I was like, listen, I have this idea. Do you want to join forces? And, I will do the legwork. You're a vital piece to this. So, we are new, and essentially to get our name out there, a lot of what we're doing is, reaching out to physicians, reaching out to inpatient facilities. I am trying the Instagram thing, learning the technology piece. I am so not good at it. We're trying. We have a website, but it really, we're kind of very much in the beginning phases of it. So trying to do things like this and just kind of let people know we're here. We are new, and it's a newer concept, especially for Hunterdon County. A lot of eating disorder programs tend to be inpatient or IOP, or it's clients making up their own team, which requires running to different providers all day. So, we are newer in that sense and trying all the avenues, but I don't know, what else have we?
No, I just am thinking some people just come in from word of mouth, like, hey, my friend sees you for therapy. Can I see you? Or, hey, I was talking to someone and they have a dietitian and they like meeting with you. Can I meet with you? So we do get a lot of people that way. We also do work with many health insurances, and a lot of health insurances have our information on their sites, and people find us through health insurance as well.
Nice. It's really neat how it's a combination of your expertise that has created this benefit for people. And it's really neat to see what you can accomplish with that and making it so much easier for potential clients. Absolutely. Mm-hmm. But now what about when somebody is scared to ask for help? They don't know where to turn first. What do you tell those people?
So I think it's interesting. I think that's I think that tends to be a common place for people to be in. I think eating disorders specifically are they're tricky. I think they can be hidden for a very long time. I think they can be normalized. So I think a lot of people come to us unsure of what it's going to look like. And really, I think Michelle and I both strongly believe in kind of just being a support system for them. And as we provide, education and support and just essentially a safe space. That's like our number one goal is for you to come here and feel like any thought is okay, to feel like you can share any, behavior you've engaged in or thinking about, and then the more kind of stable I think that we remain for people, the more that they're willing to try the process, if that makes sense.
Right. Yeah. I was just going to say the same for me. Like a lot of people aren't ready. They were brought in because a parent is making them come, or their provider, doctor is making them come in, and they don't really want to be here. So a lot of times it's, it just depends on where they're at in the level of readiness for behavior change. So sometimes it really is just about educating them, educating them nutritionally, like where do our calories go? A calorie is really a unit of energy. And the more energy we have, the more energy, you will feel in the day. So sometimes we just start with education.
It's incredible too, just, from my fitness background, hearing people ask questions about nutrition. And there's been so many times I'm like, go talk to someone whose expertise is this, because there is so much need for more education in the nutrition space. And this is a whole other rabbit hole, but it's terrifying what we so often think of as a healthy meal, and you start to look at what it's really made of or what kids are being served in schools, and there's so much there. So we need more and more people like you guys who are helping the whole person from the eating standpoint, from the psychology behind it all. And I think it's just incredible what you do every day. And you made me think of something when you were just answering that last question. When people come in and, like you said, maybe sometimes their parent dragged them there, that kind of a vibe, so to speak, is there a way that you find it very helpful to reset their mindset around it, to get them from that space of, I don't want to be here, to seeing what a help this could be?
Yeah, I mean, I think so much of, at least like the therapeutic standpoint, so much of it is just building that relationship in the beginning and kind of explaining that, there are factors that probably have contributed to this that you're not even aware of, when there are behaviors that serve purposes. And, I think the more that they genuinely trust us, I feel like the easier it is for changes to happen. And the other thing that I love about this space is they see Michelle and I together. They see Michelle and I, eating together, hanging out together, laughing together. And I think that is helpful in that they know I trust her and she trusts me, and therefore, like, we're not going to advise them to do something that we don't actually genuinely believe in.
Right, we practice what we preach, so yeah.
That trust factor.
I also think they see us just as normal people, you know what I mean? Like, I'm not going to sit here with my hands crossed and like, I hear what you're saying and how does that make you feel? Like, we don't do the traditional kind of old school therapy in that sense. I really just genuinely want to get to know them as a person.
And sometimes they come into me too, and they're like, crossed arms, and they don't want to talk about anything. They don't want to talk about food, and I'm like, I am not here to take away your food. I'm not here to tell you what to do. You've heard the term like food police. I am not here to be that. So I think once they like realize that, oh, okay, she just wants to like ask me some questions and like just kind of help me out, and what things do I like to eat, or what am I worried about? I think that, I think we're both actually really good at kind of meeting them at their level where they are and kind of building that trust and going from there, you know.
I feel like your office must be this like cool, relaxed, chill place where you could sit down with a cup of coffee and have a chat. Like that is absolutely the vibe I'm getting.
Yeah. No,
come anytime. Come visit us.
I think I'm going to have to for sure, especially because I read that there's a kitchen on site too. So you actually are doing, Michelle, like the action of creating things with clients too, right?
Yes. Yep. Absolutely. We have like our fun snack drawer, and then there is like, again, a microwave. We have plates and we have dishes. We can make things for people, with people, show them how to make a balanced meal, put a balanced snack together. If someone hasn't eaten anything, I'm like, all right, let's pick something out. What are we eating together today? Obviously no one's ever forced to do that. We kind of make it, fun. It's what really food is. We try to make food and eating and health, obviously, fun.
That's excellent. And now, what is something, that our audience can do today to just take a step in that direction of more calmness about, we could say specifically food, we could say life and the day to day? What is something that you see that is really beneficial that someone could take away from this?
I mean, I think a lot of it is too, I feel like people will come in, and one thing I hear a lot is like, I feel like I can just be me here. I can just breathe. And I think, it's hard. It's like you had mentioned earlier when you hear people talking about fitness. I know it's difficult to do because we have all of these things in our face all the time. But I think one of the most helpful things to do is to kind of just turn everything off around you and try to just get in touch with who you are, as opposed to, following all of these, like what I eat in a day, and if you're in a calorie deficit, and and you should do Pilates this many times a week, and then you should do cardio like all of that gets very, very muddy. And I think people end up getting very confused by it. And when you pair all of that with trauma and low self-esteem and poor body image and like family issues, social issues, you end up with a big storm, a really big storm. So I think the more people can kind of just turn away from all the outside things and focus on, just appreciating who they are and what their body does for them. And, we always like celebrate little successes. Like it doesn't need to be big. It does not need to be big. The smaller, the better. Like, because again, that's more sustainable.
That's like one of my favorite hashtags is every bit counts, because it really, those are the things that add up over time.
Yeah. You're right. For sure.
Well, great advice across the board, Kathleen, and thank you both so much. This will also be in the notes, but just say out loud for us, what is the link to your website?
So our website is, it's AuthenticYouFlemington.com. And then we have our like little Instagram. It is not much yet. I am slowly learning.
You're doing pretty good.
But it's AuthenticYou224. And yeah, I mean, on our website, we have, emails, phone numbers, all that kind of stuff. We're really just here to support whoever, and it could be anything from not having a great relationship with exercise or body image or but it's cool. We have a really, really great group of clients. And it's been a really nice experience.
Yeah, for sure. It's really awesome. I mean, we have some athletes, and they come in and they're like, why am I not doing the best at my sport? I'm like, well, nutrition can help you with that. So let's see what we can do, so. And I always tell people, like, a good quote that I like is, your body is the greatest instrument you'll ever own. You have to take care of it. We have to fuel ourselves properly for that. So
it's so true, right? If we don't take care of ourselves, how can we show up for the rest of the world?
Right. And it starts with here, right? And it go, everything else, like we have to start with our mind and mental health, and then obviously physical health as well. So that's what we're here for. The more people we can help, the happier we feel, right?
Yeah.
Well, it's very clear that you love what you do. Michelle and Kathleen, I can't thank you enough for sharing that with us today and just all the insights and tips as well. Just best of luck with the practice.
Thank you so much. Thank you for having us.
Thanks for tuning in to A Dose of Health, part of Healthy in the Garden State. For more, check out healthyinthegardenstate.com. Here's to living our healthiest self in New Jersey.